Okay. Welcome, everyone. Good afternoon. Thank you for joining us today. My name is Emily Haynes, and I'm the Director of Public Health Initiatives at the Partnership for Maternal and Child Health of Northern New Jersey. I'm excited to welcome our panelists today for our COVID-19 vaccines Q&A. So the Partnership's Epidemiology and Laboratory Collaborative and our partners and the Essex Metro Immunization Coalition have joined together today so that we can all learn more about COVID-19 vaccine resources in New Jersey. So I'd like to have our panelists introduce themselves. We'll start with Sarah, and we'll go around to tell everyone who we are, what we do, and the organization that we work with.
Good afternoon, everyone. I'm Sarah Arshad, and I'm the program coordinator working for the Epidemiology and Laboratory Capacity Grant. As a regional grantee of the New Jersey Department of Health, we're working with community-based organizations across Northern New Jersey to help develop and implement effective health communication and community engagement strategies to help get people vaccinated, tested, and meet the needs of the most vulnerable populations across Northern.
Okay, great. Thank you, Sarah. Solange, can you introduce yourself?
Hello,
Please.
everyone. Thank you for having me here. I'm Solange. I'm the community health worker for Church World Service. We are in the resettlement of refugees and asylees. Thank you.
Thank you. And Kim, can you introduce yourself, please?
Yes, hello, hi everyone. I'm glad to be here. I'm a community health worker and I work with New Community Corporation in Newark.
Great. And last but not least, Jacqueline.
Hi, my name is Jacqueline E. Barnes. I am the community health worker for the Willing Heart Community Care Center located at 555 Dr. Martin Luther King Boulevard in Newark, New Jersey. We are an organization that's built from the Metropolitan Baptist Church, where we help our community and our surrounding communities.
Great, thank you so much. So we're going to address some of the most common questions that we hear about COVID-19 vaccine. And if you have questions, you can also post them, and we'll try to get to all the questions today. If you have questions and you want more information, you can also visit the New Jersey Department of Health COVID-19 website, which is listed in the text of this program also. It's covid19.nj.gov. So Solange, we'll start with you. Who is eligible to receive a COVID-19 vaccine in New Jersey?
Currently, everyone 12 years of age and older is now eligible to get a COVID-19 vaccination. And get a COVID-19 vaccine as soon as you can, because widespread vaccination is critical to also help the pandemic to be stopped.
Thank you. And Kim, where can you get vaccinated in New Jersey for COVID-19?
Oh, we have several pop-up events that take place all throughout the city now. You don't need an appointment anymore. You could just basically walk in to get an appointment. You can go to your local pharmacies like CVS, Rite Aid. You can go on the COVID-19 website for a list of available places where you can go and get a vaccination, because they have the most accurate list. You can call, you can text 211. There's a phone number where you can call 855-568-0545. And there's also a senior hotline number where you can call. The number is 856-249-7007. So you can try any number of those options to schedule for your vaccination.
That's great. And Jacqueline, does that include children as well? Is that they can go to, where do children go to get vaccinated that are 12 and older? Where can they go?
They can come to same place, pop-ups, places like I know NJIT was doing it. We here at the Willing Heart was doing it as well. Actually, we have an event coming up on August the 28th where we're doing a book bag drive, and we're going to have a pop-up tent for the vaccination. If you're over 12, you get the Pfizer, and if you're over 18, you'll be able to get the Moderna. But Johnson & Johnson will be here as well.
That's great. That's great to know. So there's pop-up events happening, and especially
Yeah.
now it's almost back to school time for children. If you haven't already had your child vaccinated for COVID-19, it's really important to start that process because there are 2 doses required for the Pfizer vaccine, and there's a month apart. Or three weeks apart for Pfizer, right? So, you know, you want them to be fully protected as soon as you can for them to start school in the fall. So that's a great event to have for book bags, and also to make sure they're up to date on all their other vaccines too, if they're behind.
Mhm.
So Solange, do you need insurance to get a COVID-19 vaccine? Do you have to show ID? How does someone who's uninsured get a vaccine?
Thank you for the question. Right now, the federal government is providing vaccine free of charge to all people living in the United States, regardless of your immigration and health insurance status. You'll just need an identification card to have your information reported on your vaccination card. Otherwise, you can expect to be asked demographic, occupational, or medical screening questions. But they will need your name, address, date of birth, ethnicity, and gender. And all this information will be securely stored in the New Jersey Immunization Information System. So if you are not insured, you can still receive your COVID-19 vaccination.
That's great. And does that apply for children also, if they don't have insurance? Yes.
Yes, that's the same as for children.
Great, great. And Kim, do you need an appointment to get a COVID vaccine? Can you just walk in anywhere? Can you explain, you know, for someone that says, yes, I'm ready to go get my COVID-19 vaccine today, what's their next step?
Show up. Initially, when it first started, they did have to have an appointment. They had to register. They had to go through a process. But now, with the rampantness of the vaccine, the COVID-19 infection, you no longer need an appointment. You just pop up at one of the pop-up events. As long as you know the location, the date, the time, just show up with your identification if you have it.
Okay. And if you don't have it, you just still show up?
Yes.
Okay.
Still show up.
Okay. And how long can someone expect it to take to get vaccinated? Jacqueline, could you share what can we expect when we show up for a vaccine?
Well, in the beginning, it took a little bit because everybody came, but now it's if 10 minutes, you probably get it done. You put in signing your name, and here I kind of pre-register the people, get their information so that when they get here, the ones that are taking them in, they already have that information, and they just walk and show their ID, sit down and wait for the nurse, 5 minutes. They call you, give you a needle, done. Sit down for 15 minutes and wait to make sure that you have no reaction to the vaccination, and then you can leave. So I would say a good 10 minutes at most, or at least here at the Willing Heart. So I can't speak for other places. So.
Yeah, so, you know, between 10 and 20 minutes, probably most places. And if you have some time on your lunch break, you could go do it then. What about for people who are working? Are there options for after work or on the weekends?
Yes. There
Kim,
are
can you tell
options
us
for,
more?
yes, there are options. They have pop-up events and they have times where they have like, they may have a food distribution event and they'll have the van there between like maybe 5 and 7. So if you get off work at 5 o'clock, you still have time to just shoot on over before 7 o'clock. Some events last as late as 8 o'clock. So they do have after work hours.
Great.
Just
And Sarah, did you want to say something?
Yeah, if anyone would like to book an appointment, you can go on vaccines.gov or any major website of stores such as Rite Aid, CVS. They'll typically have options for different timings. If, say, you want to get booked on the weekend or after work hours, those will be options that are available to you. And as far as identification goes, you can also bring mail, anything that just indicates your name and address, and doesn't have to be any formal identification if you want to get vaccinated.
Great, thank you. So Solange, how do follow-up appointments for a second dose work? For Moderna and Pfizer vaccines, it's a 2-dose regimen. And as we look to the CDC for guidance about potentially 3rd doses as well, if a 3rd booster dose is now recommended for immunocompromised individuals and potentially for other groups, we're watching that. But for those follow-up doses, how do you make a second appointment? You go, you get your first dose, now what happens?
So there are 2 options. So after the vaccine, your care provider will tell you, according to the vaccine, when is your second dose. And then at that moment, you follow up by yourself. You look closely to the date and then you go and get your second dose. The second option is to enroll in the VSafe app. That is a tool that everyone that have a smartphone can use, because you use text messages and web survey to provide personalized health check-in after you receive your COVID-19 vaccine. So VSafe will remind you to get your second COVID-19 vaccine dose if you need one. So your healthcare provider can also help you with that information, how to use the VSafe.
That's great. So it sounds like it's a good idea after you get vaccinated to sign up for the VSafe program, VSafe texting, and it can help you monitor any symptoms you might have after getting the vaccine, and also remind you when it's time for another dose.
Sure.
Great. So Sarah, could you tell us, does the COVID-19 vaccine work?
Yes, the COVID-19 vaccine does work. It is effective, and it is actually tremendously helpful in stopping the spread, especially with this new Delta variant. It has been tried and tested through many trials for several study participants and have been verified for its safety and efficacy. So if you're worried about the sort of trial and how quickly it was rolled out, in terms of the vaccine process, know that the COVID vaccine has been in the process of being tested for years prior to this pandemic, and that it has only been rolled out with a high standard of ethical commitment, of safety standards, and is highly effective in stopping the spread of COVID-19. And your best bet in order to avoid infection and also long-term health consequences is to get the vaccine. And you're better off placing your bets on that than to go unvaccinated.
That's great. That's great. Any of our other panelists want to add more information about if COVID vaccine works, if it's safe? What do you tell people to help encourage them to get vaccinated?
I tell them is look at the facts. What are the facts? The facts is that we have over 500,000 people that died that did not make it and did not get the vaccination. I tell them, let your conscience be your guide. If you see what's going on, and wear your mask, be safe and be careful. I mean, No one has to browbeat you to do it. So you should just go ahead and get the vaccination. It's something that's going to save your life. I'm not a doctor or a nurse. I preface every time I say that to someone that I know, but the vaccination can help and it is safe. Don't listen to the press. Don't listen. Just get the vaccination.
That's
Well,
good advice. Go ahead, Kim.
I have a kind of a different approach. I definitely look at the person that I'm talking to or the person that's hesitant about getting the vaccine, and I try to fill them out first. And then I try to tell them how I used to tell my children, mommy didn't get the vaccine for myself. Mommy got the vaccine so I can continue to be a mom. I got the vaccine so I can still be here to watch you grow up, to make sure and keep you safe. I got the vaccine first so that all the conspiracy theories that you guys heard about, now you say, I still have both my hands, I still have all my fingers, I still have all of my toes, I don't have Bell's palsy or any of those other things that they were hearing about in social media and throughout their friends and everything. So they were able to look at me and say, she's still here, So I had to tell them, I said, it's just like getting childhood vaccines. When mommy used to take you guys to the doctor, you came home, you guys were safe. I said, if mommy needs to take you guys to get this, I'll be with you. So it's the same thing that I try to do people outside of my household, especially when we're dealing with the community. If you need me to go with you, let me know. If I'm right there with you at the time of the vaccination event, I'll walk in there with you. If you need me to hold your hand, I'll hold your hand. Whatever discouragement they may have, I try to help them by easing them, by giving them my information, because that's all I have is my story. All I have is something to help them feel a little bit more comfortable about getting it, because sometimes people have their mind made up to be a no. And if their mind is made up to be a no already, there's nothing that you can say to dissuade that, because their no is going to be their no. So if you have an opportunity to where you can kind of get in there and let them know that it's okay if you're scared, it's okay if you're unsure, take it one step at a time, but breathe through it, because you're not by yourself. Everyone is coming to the choice and the decision if they're going to get it or not. So that's my approach. That's how I try to get people to feel a little bit more comfortable and relaxed about actually getting it done. Don't do it for yourself. Do it because you want to be around for your loved ones. You want to be able to hug them. You want to be able to have dinner across the table from them without, looking at them like something is wrong.
Yeah.
So, yeah.
Kim, that's so important. It's such an important message because we are all hearing about the Delta variant in the news. The Delta variant is twice as contagious as the previous strain of coronavirus. Right. And we are seeing increased hospitalizations in people in their 30s. These are people with young children. These are moms and dads with young families. And if you haven't gotten vaccinated yet, this is a really important time to do it. If you've been waiting, now's the time. You do not want to be at more risk of getting the Delta variant of coronavirus right now. So make that appointment, make that step to get vaccinated, do it for yourself and do it for your kids, like you said, Kim, so you can be around for your family.
Yeah.
So
a lot of us have older adults.
Mm-hmm.
We have grandparents, aunts, uncles that are older than us that are, carrying the generations, and you don't want to be the one that want to give them a hug and now they're sick. You don't want to be the one to have to carry that weight if they can't get over it because you're stuck in a no, or I'm not going to get it done, or it's not for me, whatever excuse or reason that they may have. It's really real.
Yeah. Thank you, Kim. Thank you. Solange, you had your hand up. You had something to add?
Yes, it depends on the concern of the person when there is hesitancy about the safety. So I'll tell them that the safety is ensured because the FDA has gave its authorization, emergency use authorization for the vaccine, because the vaccine has fulfilled the standard for safety, effectiveness, and rigorous scientific standard for the FDA. So it's They don't have to be afraid of it. They just need to go ahead and protect themselves and their family, because billions of people outside there have already received the vaccine. And the COVID-19 is something that they have not seen it before. So it's important for everybody to take measures to protect their family and their community.
That's right. That's right. And I looked at this morning at the COVID-19 dashboard on newjersey.gov, and I saw that we're almost at 5.5 million people in New Jersey have been fully vaccinated. So you're in good company. Go get vaccinated, right? It is safe. It is effective at helping reduce hospitalizations and death. And this vaccine could save your life. And I look at this screen, this wonderful panel of knowledgeable women that know about COVID-19 vaccine, and they are out there in the community answering questions. They are a wonderful resource if you have more questions or you need to connect with them about any specific questions or where to go to get vaccinated. This is a great group to get in touch with. So we'll make sure that everybody's information is in the comment section. And Sarah, you can connect us with how to get in touch with everyone. And thank you so much to Kim and Sarah and Jacqueline and Solange for joining us today. Again, if you have questions, covid19.nj.gov is a great site to visit for all COVID-19 vaccine resources. Thank you so much for joining us today.
Thank you.
Thank you.
You.